If you've started taking anastrozole and you're noticing changes to your hair, you're not imagining it, and you're not alone. Anastrozole is an aromatase inhibitor widely prescribed across the UK for hormone receptor-positive breast cancer, usually in postmenopausal women. It works by blocking an enzyme called aromatase, which the body uses to convert androgens into estrogen. This significantly reduces circulating estrogen levels, and that's exactly what makes it effective at slowing estrogen-dependent tumours. But estrogen also plays a role in the normal hair growth cycle. When levels drop that dramatically, it can disrupt that cycle in some people, and that's why hair thinning is a recognised side effect. In fact, the MHRA approved summary of product characteristics for anastrozole classifies alopecia as a common adverse effect, estimated to affect between 1 in 100 and 1 in 10 people who take it. So this is an established, documented association, not just a handful of anecdotal reports. It's worth understanding what this hair loss typically looks like because it's not the same as hair loss from chemotherapy. With anastrozole, you're more likely to experience diffuse thinning, hair that becomes finer and less dense across the scalp. Some people experience telogen effluvium, where more hairs than usual shift into the shedding phase at the same time. The pattern varies from person to person. That said, hair thinning can have other causes too. Things like low iron, vitamin D, B12, or thyroid problems. Your GP or oncology team can check for these, which is another good reason to bring it up rather than assume it's definitely the medication. So what can you do about it? First, and this is really important, do not stop taking anastrozole without speaking to your oncology team. Stopping treatment without medical guidance could significantly affect your cancer management. Hair thinning is a completely valid concern to raise, but please raise it with your doctor rather than making changes on your own. Topical minoxidil is available over the counter in the UK and is sometimes considered for treatment-related hair thinning. However, its use for aromatase inhibitor-related hair loss is off-label, meaning it hasn't been specifically licensed for this purpose. So speak to your GP or oncologist before starting it. It's also worth knowing that support is available. NHS wig services are available for people experiencing treatment-related hair loss. Ask your oncology team about what you're entitled to. Macmillan Cancer Support and Breast Cancer. Now, both offer practical information and emotional support. You don't have to navigate this alone. If you experience hair thinning or any other side effect while taking anastrozole, you can also report it to the MHRA via the Yellow Card scheme at yellowcard.mhra.gov.uk. Reporting helps monitor the safety of medicines in real-world use. To recap, anastrozole can cause hair thinning in some people. It's a recognised common side effect linked to how the medication reduces estrogen. The hair loss tends to be diffuse rather than complete. Your team can help assess what's happening, rule out other causes, and discuss your options. And if the hair loss feels sudden, severe, or is accompanied by other new symptoms, contact your healthcare professional sooner rather than waiting for your next appointment. If this video was helpful, leave a comment below, especially if there's another medication side effect you'd like us to cover. Give it a like and subscribe to Bolt for more clinically checked health information. And remember, always speak to a healthcare professional for advice tailored to your personal situation.